Good evening, everyone. My name is Muhammet Zülküf Yazıcı, clinical psychologist. We're so happy that you make time for us at this time of the day. We have Professor Alp Üçok, psychiatrist, and we will be talking about psychosis, the symptoms, treatment, and we will be talking about different aspects of this condition. We are so grateful to our professor for making time for us tonight. So, without further ado, I would like to give floor to Professor Üçok. Hello, thank you. Psychotic disorders is interesting for people on general level. But other conditions such as panic attack or bipolar disorders, there are less accurate information about psychotic disorders. Today, I'll be talking about some general information about psychosis. So, generally, psychosis is used as a negative connotation, but it is actually an umbrella concept which contains conditions characterized by distorted reality testing. Schizophrenia is one of the most known version. Schizoaffective disorders, schizophrenia disorder, delusional disorders. Some mood disorders are also characterized by psychosis. But to sum up, psychosis is a distorted reality testing condition. This can happen in healthy individuals as well. Reality testing, differentiating between what is real and what is imagined, what is dream, what is fantasy, what is real. Sometimes we are thinking about something, but if we do not have a good reality testing, we might think that it is actually happening. Or if something happening in our dream is just influencing our entire day, then or people might think that they're hearing voices and coming from the other world, from the deceased persons. Actually, it comes from the brain of that individual. So when this reality testing is distorted, people might have psychotic experiences, sometimes lasting for minutes, sometimes lasting for years. Let's say we wake up from a dream, someone was chasing us in our nightmare, or we lost our watch in our dream. We check our watch, we say, oh, that was a dream. So everybody might have short-term distorted reality testing, but when we call it a diseases, we're talking about a long-term distortion and a life-affecting distortion. Everything is a curve in nature, like the intelligence. There are certain percentages of gifted, and there are the lower rate, the average intelligence. The same thing applies for the length of the trees, the number of steps that we take. Everything has a place on this curve. Psychotic symptoms can also be in a curve. They can either be mild or can be severe. Everyone might have them. Sometimes we are not even aware that is a symptom. So what is this red line here? That red line indicates who are we treating with psychosis. That's almost a randomized. These are quite common in medicine. For instance, blood pressure. Let's say if the blood pressure is between 150 to 90, or the insulin levels. So this red line indicates who needs treatment. And we decide to treat or not by looking at the consequences of not treating. When we treat something in psychiatry, we should look at the consequences if not treating of that conditions. The life cannot be sustained, work cannot be sustained, family relations, the people in his or her neighborhood. If these are all impacted by this condition, then we have this red line and you are in the blue zone and you need treatment. When we look at the symptoms of psychosis in children or adolescents, if you treat 1,000 kids, 80 of them might have some psychosis symptoms. For instance, kids might say, I had a dinosaur underneath my bed, or they might say that I flew with the broomstick, or they might say that, oh, my team definitely be the champion this year. These are some small examples of distorted reality testing. They made an online survey last year in UK, and a great majority of them said that if they are resenting their friends, saying that if they had a chance, they might do something bad to them. We might always think that our people around us are not thinking for our benefit, or they might try to harm us if they can. But this is not a disease in its own form. But psychosis symptoms are usually seen in the 4% of the population. In mania and depression diseases, substance abuses are more common within this 4%. And in 3% of the population, which is not a small number, schizophrenia, schizoaffective disorders, and delusional disorders are relevant, and these are serious psychiatric conditions. We said 8% in adolescents. When we just screen the people on the street, maybe we will find 8%, but when we check again in 1 year, these symptoms go away. If they are persistent, then they can be a condition. The admiralship of this conditions within this, under this umbrella, is schizophrenia. Schizophrenia usually begins between the age of 18 to 35. It's a chronic mind disease. It's not just a brain disease. It is more like diabetes mellitus, or it is most like other chronic diseases such as rheumatoid arthritis or hypertension. It has a waxing and waning course. There are heavier symptoms when there is waxing and also waning. Some functionalities come back when it's going mild. What is different about schizophrenia that it interferes with brain functions in thinking, perception, behavior, reading between the lines, trying to just be appropriate in social settings. This is hard when there is schizophrenia. And it deteriorates the professional and social functioning more than other diseases. And these people do not really look like each other. When you see a couple of people with schizophrenia, they will all look different. And lifetime prevalence is 1%. So 1 out of 100% in the population might have this unfortunate statistics of having this disease. And they have a 20% less life expectancy compared to their peers because of some other comorbidities. When we look at the symptoms, there are some positive symptoms. These are not peculiar to this illness, but these are like flags, red flags. The family members, neighbors, classmates, and teachers see something different in these people, being very suspicious, being very resentful, or hearing voices. These are, we call them positive symptoms. Negative symptoms that we will be mentioning in a minute. Some cognitive functions are decreasing or even blunting. So, for instance, affective bluntness, alogia is one of them. I will talk about them in detail. And there's another group of symptoms which we call them cognitive symptoms: attention, retention, executive functions such as problem solving, planning. So these are all hampered. For instance, in people with dementia or Alzheimer's, we see these symptoms as well. But people with schizophrenia having these symptoms in earlier ages, and it is causing a lot of debilitating functionality losses in people. So when these symptoms emerge, maybe years before, at least 3 or 5 years before a person is diagnosed, during the teenage years, there are some early disorders. They can be like lack of insight or resentfulness, having suspects about certain things, lack of attention, learning difficulty, especially in high school years. We'll see some picture shifting into psychosis. The school grades are also dropping. Having doubts about the neighbors or accusing families that you are not my family, you stole me from my family. These are usually happening at the beginning of 20s. But this can be improved by treatment. But attention, concentration, lack of motivation, this dark blue, they continue throughout the condition. We still do not have medication for these symptoms. This being having doubt, suspicion, resentfulness. So we can treat those delusion, disorganized thinking, cognitive better, but this lack of motivation, not being eager, we cannot treat them with medication. So let's continue with the symptoms of schizophrenia. As the non-professional, what should we be careful about? There is an acute phase and there is subacute phase. Acute phase is noticed by almost everyone. Even a 5-year-old child might notice the acute phase symptoms, such as why this lady is laughing on her own, while he is throwing books to the garden, while that person is talking to the invisible people. So these symptoms are easily noticeable. Usually it might need hospitalization, because in psychotic disorders, in the most acute phases, they are feeling that I'm not sick, everybody is my enemy, there's nothing wrong with me. Quite naturally, they think they are not ill. And it's very hard for them to volunteer for hospitalization. So wanting or without wanting, we might have some forced hospitalization at this phase. And after this acute phase is gone, let's just like a person with diabetes, still the insulin levels are not normal, but still it can be sustained with medication. There are some persistent symptoms. These are not common in each and every single patient. They might differ from one person to another. Some people have insomnia, the others have not taking care of themselves. But we can say that they have a waxing and waning course. So in hearing some whispers, but these do not really disturb this person's relationship with the surrounding. Difficulties in social contact. Most families see that. Yes, they do not have cognitive distortions, but still they are having difficulty to communicate with their friends and just being present when the guests arrive. So they might have this continuous difficulties in social contact, feeling unhappy or depression, inability to experience joy or pleasure, just like walking the dog, making a cake, playing football. Those things that these patients used to enjoy, they do not feel joy anymore. They might have some poor grooming, having less showers, not taking care of themselves, not shaving, just not changing clothes on a regular basis. There's a general lack of energy and motivation. Even if they want something, they do not have energy, as if their entire energy is drained. They all might have unusual thoughts. They might have some weird cause and effect relationships. Since I'm so sad today, it's raining. So not causality links are not healthy. Again, starting in the adolescent years, even before they've been diagnosed, difficulties in attention and concentration might continue. Maybe in high school years, that person can be quite successful. When he or she turns 30, that person might say that I used to read once and remember everything. Now I have to read like 5 times before I remember. So this is a persistent symptom. Negative symptoms are usually persistent. Let's remember them again. Reduced emotional responsiveness, not exactly frozen, but restricted or blunt affect. Reduced interest or reduced social drive. Reduced speech. They're asking why you are so silent, why you don't say a lot. I'm also aware of that, but I cannot find topics to talk about, they say. Poor grooming or limited eye contact. So there are similar symptoms, and these are negative symptoms. An unfortunate part of negative symptoms are they are misinterpreted by families, saying that you are lazy, you are just so spoiled. Everybody's child is so successful at school, but you are so useless. So family or the friends or the relatives are reactive to this young people. Even yes, these young people are aware that something is going wrong, but it's not their fault, and they are just facing all this backlash. So, what are the reasons of schizophrenia? It is not yet fully known, but we are finding new pieces every day. Even though we know some reasons, it is maybe true for patient A, but it is not for patient B. Let's say if you are contracted with COVID microbe, most people get COVID, but not everybody is under the same risk factor. We cannot simply say that it is the exact reason. There's a role of genetics, structural changes in brain, and also neurotransmitters. Their production of chemicals or differences in the receptors is also increasing the risk factor in this illness. But we can say that there's an interaction of genetic and environmental factors. For instance, substance abuse, migration, growing up in a crowded city, fathers or mothers, maternal infection, father's age, some physical, sexual abuse, neglect, anoxia during delivery. These are all altering genetic structure and increasing risk factor. Substance abuse is increasing all over the world. People are thinking that cannabis is nothing, but cannabis is the most determinant factor increasing psychosis. But it is which comes first, egg or chicken? If you are psychosis, you use more cannabis, or if you are consuming cannabis, that you are more prone to psychosis. It is kind of both. Most people are saying that this is not even chemical, that's organic, that's just a plant. But especially if people start using cannabis in early age, this tetrahydrocan TLC, if there's a high TLC, and if there's a psychosis history in the family, smoking cannabis is making that person quite prone to schizophrenia. If we can remove cannabis use from the society, at least 6% of people with schizophrenia will not get this diagnosis. And I think it's a huge amount. This is just one of the environmental factors, and I'm just giving that as because it's popular. Yes, the use of cannabis is increasing, and also the amount of people thinking that cannabis is harmless is also dangerous because it is a risk factor for psychosis. So, neurotransmitter model, there's dopamine, serotonin, and glutamate, and we can also talk about adrenaline maybe, during the production, and also these receptors and the sensitivity changes might also increase the risk for psychosis. And the treatments that we are providing is about remedying this distorted balance. I want to talk about the role of genetics. The higher the shared gene is there, there's high risk. If there's one person with schizophrenia in the family, if one of the siblings is schizophrenia, the chances are 8 times more in the other siblings. It is 1% in the society, but if there's one sibling in the family, it's 8 times more. If one of the parents are ill, it is 12 times more. Of course, the biggest risk is in identical twins. If one of the twins is ill, there's a high 50% chances that the other twin might have it as well. In fraternal twins, it is not quite different from regular siblings. Again, if one is ill, there is a 17% higher chances of the other one is also ill. There is a frequently asked question that my fiance's uncle has schizophrenia. Is it possible that our child would have the same thing? It is very small because there are all other risk factors anyway. So it is negligible risk. We are seeing that there are some changes in the brain in schizophrenia even before they get the diagnosis. Shrinkage of hippocampus is quite common. It's about retention of newly learned information, knowledge. It's like an interim station. For instance, in the right-hand side, you see the healthy hippocampus, and on the left-hand side, you see a hippocampus in schizophrenia. It is shrinking, and they're having hard time to remember something they have learned. The teacher is just giving some names, dates, formulas, but I don't remember them in the next class because hippocampus is small and it's not functioning well. There are some similar problems in brain in terms of problem solving or some other executive functionings are problematic because of not receiving enough blood and oxygen. These are some structural brain problems. Previously, I've talked about communication among neurons. It can be a reason of psychosis. There are around 87 billions of neurons. That's an incredible number. And each of them have at least 10,000 connections. So it's an amazing computer system. Of course, they do not play whisper games with each other. Then there's one terminal, axon terminal, and there's a synapse. When you see the substances from the tip goes to, it's like a key goes to keyhole, and it opens the door. These red dots are like neurotransmitters. When they are not released enough, or when they are released so much, or the other synapses, the receptors, if there's not enough receptor, or if they're not sensitive enough, if they are too sensitive, it distorts the communication and they're having difficulty to think, to evaluate, or to assign meaning, or whatever is happening is difficult. Last but not the least, I want to talk about treatment. Actually, providing just one medication, he was saying that it cannot really replace the comfort of feeling understood. In these complicated diseases, just prescribing a medicine in 15 seconds and sending the patient away is never a cure. Of course, there are biological treatments, but psychotherapies have to be combined. There are very few numbers of psychologists and psychiatrists dealing with schizophrenia. These type of illnesses are usually avoided by even the mental health professionals. They do not really want to go there. But the combined treatments are having better outcomes. So let's talk about biological treatments first. Almost all newly found medications are available in Turkey. The actual problem is the psychotherapies in the well-off countries. We cannot really say that they are quite advanced. In the Western countries, even though they are very good in research, when it comes to actual patient treatment or receiving holistic treatment, in United States, actually, it is worse than Turkey, in my opinion. Antipsychotics are usually oral treatments, or if they refuse to take pills, and if they do not have a social support to remind taking the pills, maybe monthly injections can be used. This is mostly preferred by individuals. If they have depressive or obsessive symptoms requiring treatment, then antidepressants can be used. ECT, even though it's not quite in the schizophrenia, or if people are not responding to the conventional therapy, ECT can be used as well. And in psychotherapies, we are trying to provide individual supportive psychotherapy. For instance, being able to chat, being able to listen, ask for help, problem solving. So these distorted functionalities are tried to be renovated, reconstructed with the help of psychotherapy. Some art therapies can help that. Social skills training can help. Maybe this person is not quite willing to talk about it, but art therapy would help this individual to express his or her emotions, and they will make them help better. I think the weakest aspect that we have in Turkey is vocational rehabilitation, because in many countries, since there is a high rate of unemployment, and even healthy individuals are having difficulty to find a job, and the patients with psychological conditions are having a hard time to re-engage with the society. They cannot get enough support that they would need. And I think vocational rehabilitation is something that we should work harder as a country. That's all from my side about psychosis. If you have any questions or contributions, I will be happy to listen. Thank you very much, Professor, for all this important information that you shared with us. We mentioned that we have simultaneous interpretation available during the meeting, and we have more than 20 we have participants from more than 20 countries, and they have listened to your presentation in English as well. So if you allow me, I would like to relay the questions that our participants have sent to us. One of our participants asking that, I have a roommate who has schizophrenia. He is drinking a lot, and he is having substance abuse. Is it relevant with his condition? Which one is he drinking because he has schizophrenia, or the other way around? In the Western countries, there is 50 to 70% relevance of drinking and substance with schizophrenia. So this causality here, just like in the Mona Lisa slide, we cannot really say which comes first. Especially cocaine or ecstasy. These are uplifting, energy boosting substances. They are actually using them to treat themselves without knowing, because the persisting symptom of the diseases is lack of motivation or lack of energy, not feeling joy about life. By using these substances, they are trying to help with the symptoms, but while they're trying to help themselves, they are also firing all these illusions and anger problem, or these doubts and suspicious feelings. These are getting even worse. So let me answer your question this way. It is the chances are so high that there is a high relevance. So those individuals smoking cannabis are more prone to schizophrenia because of the neurotransmitter problem in the brain. But as I've said, without knowing, some patients with diagnosis or without diagnosis can use substance to help with the symptoms. How about alcohol? Long-term alcohol usage might cause paranoia, and it actually it causes some additional problems, feeling paranoid. Sometimes the individuals who would like to stop using medication try to compensate that with alcohol and drugs. Some individuals are saying that I'm against chemicals, I will not take drugs, but the cannabis, it contains more than 100 chemical content. Even parsley is chemical and cannabis is chemical, but for some reason they say, I am not ill, I'm against chemicals, but they smoke cannabis as if it is the most natural and the most healthy stuff to smoke. Let me continue with the next question. How can we understand if the schizophrenian patients can have relapses? Just like in all chronic diseases, that's the meaning of chronic. There is a inflammation and also there's a waxing and waning. So 10% of patients with schizophrenia, first they are treated, mostly they are okay. But the other, it doesn't mean that it will not relapse, but for most of the time, there are relapses, just like asthma, just like rheumatoid arthritis or hypertension. After a couple of relapses, the patient himself or herself, or even the relatives of the patients, are trying to see the signs. Because before, for instance, they start listening to music with the earphone, being angry, being resentful, start praying or stop praying. Maybe they are not signs on its own, but when they come together, they can understand if they're eating so much or if they stop eating at all. They're isolating themselves. They start wandering in the house. So these are signs. The families and friends are very accurate. These are the signs. And if the individuals themselves, the patient themselves, know about them, before the explosion, they might go to doctor saying that I'm starting to have the symptoms, and they can start their treatment before another relapse. There's one more question. My name is Dr. Aydın Yücesoy from Pendik Health Center. So what should be our support algorithm to psychosis, especially in the primary care level? Especially in the last 15 years, Ministry of Health is stepping forward to create a community-based mental health for psychosis. They are being treated not only on the hospitals, because hospitals are not the most fancy places. There's a very busy workload over there. So there are community healthcare centers, mental health care centers. How about primary care? It is essential to identify early signs. The family practitioners, we try to train them about reading the early signs, because in the early signs, they usually go to internalists or they go to family practitioners because they do not want to have a stigmatization, because they are thinking that, am I crazy? Why should I go to psychiatrist? And they go a lot to small state hospitals. So it might be helpful to train them about reading the early signs. As you know, we are hearing about the roles and responsibilities will change about family practitioners. If there's a chronic psychosis diseases and this prescription is based on a report, and if they can get this from a doctor they know, They will have a chance to chat, and they don't have to travel long distances. But the essential thing to do in the primary care, primary health, to identify the suicidal risk, and if it's a young person, if there are some chances of psychosis, that patient can be referred to psychiatrist. Thank you very much for this question. It is an important field. Another question is about the treatment of psychosis. Is there any differences between young people or elderly population? If there is psychosis, if it starts in the childhood, it has a unfavorable prognosis. Just like in other illnesses, the renal failure, the earlier they start, the deeper the traces are. But we should really understand if it is really psychosis or it is a depression or money, which might look like psychosis. There are some differences in the dosages. In the onset of the diseases, there are different responses to the dosage. If it's a child or having this for the first time in the age of 18 or 25, the same, even the half dosage might give the same success rate. The prognosis is different among women because after the age of 50, after menopause, estrogen is decreasing in the body, so the chances are high to and they might have some resistance to medication. Therefore, it is not favoring female patients after menopause. You have mentioned in your last slide, does everyone with schizophrenia should have medication or only psychotherapy is enough? Biological treatments are like bread and butter. You cannot live off one of them enough. Or it's like bread and water. You have to need more. I always use this analogy. They are complementary to each other. Biological treatments, especially antipsychotics, will help individuals to improve their cognitive functioning. So at least we are able to talk to these people in the same room. Are we going to use them for a lifetime? That's a chronic disease. But when it is about anything about human, it is very strong statement to talk about future. They say, if I'm going to use it lifetime, it's better not to use, but it is not the case. It's not something that you can simply opt out in using medication. There's a 1/3 rule. 10% of these people improve to a great extent. The other 1/3 have a regular life. The other 1/3, not in a very regular life, but still quite functional. Only 1/3, if they do not have a good treatment or if they are not able to access treatment, if they have additional risk factors such as substance abuse or not having social support, they might just be in the worst prognosis. In order to make sure that that person has the best function of his life, the biological treatment is a must. We cannot simply say that it's a lifetime rule. Let's say insulin. When these people needs insulin, they use it for a lifetime. Just because it's a lifetime thing doesn't mean that it is not beneficial. Hypertension, pressure, the medication or the diabetes medication, they're used a lifetime, and they are not asking, why should I use this medication? They're like, I'm so lucky that I have a medication for my condition. That also applies for psychiatric diseases, but they try to oppose with the medication as saying that I will overcome this disease with my own willpower. Thank you very much, Professor. You mentioned the complementary aspect of psychotherapy. And there's a question, which schools of therapy are most effective in psychosis? Individual supportive therapy is very important. The supportive therapy is not like go get a tiger. It's about to talk about what these people can do what his or her mind or cognitive abilities are capable of. Because you cannot simply expect this person to do things which is beyond his capacity or her capacity that will create even a more negative impact. For instance, staying clean, managing the budget, discussing the problems that he or she is having with the friends and families, coming up with problems, coming up with solutions to their problems, helping them with their self-expression, to make sure that what makes them angry, what makes him or her resentful, and to work on that. There's isolation, stigmatization, how these are influencing that patient. So supportive therapy is looking at all these aspects. There are some other symptom groups, for instance, hearing voices or doubts, this having all this there are CBT can be quite helpful. Metacognitive therapies can be used about the thinking processes. It can be used as individual or group therapies. So these are the first ones that I can mention. Thank you very much. A child at the age of 8 or 10 saying that my parents are not real. Can this be explained by a wide imagination, or this should be taken seriously? First of all, how many times the child is saying that? Just today, or been saying that for the last month? Let's say if he or she has been watching a movie or a cartoon, or there's a discussion. So this is important. We have to look at that first. And we have to make sure if there's psychosis in the family. If the brother is schizophrenia, or one of the parents is schizophrenia and saying that, maybe this has to be taken more seriously. But and how much complaints that person is having? There is an ABCD study in United States. They are working with more than 10,000 kids. This type of thought disorders, these are psychosis-like experiences. When a person in the age of 30 is saying that, oh, that's the reality testing problem. But when the child is saying that, it takes time for a child to redo the reality testing. 8 or 10 is not very early age. But we should also look at that, how disturbing it is for the child to say that. I think the most important here is that to wait and see. If it is just lasting more than a couple of weeks, it might be helpful to talk to a child psychiatrist. There's a question about bipolar. Is it possible for an individual with bipolarity can live alone? Different than schizophrenia or bipolar conditions are happening in different terms. And there are also times that they are fully almost normal. The, the, the target of bipolar therapy is to eliminate the next attack. But in schizophrenia, there are some persistent symptoms, lack of motivation, lack of energy. They're always there, little amount or big amounts. Therefore, bipolars are more lucky. If they have a good protection mechanism, they can have. Is it possible that the schizophrenia patients can live alone? There are many. There are many do that. But a bipolar patient being able to sustain a living and having a better performance, that the chances are higher. But we cannot say that no schizophrenia patient can live alone or work alone. Our last question then. Can you recommend us some books for families and friends of people with schizophrenia? Professor Mustafa Yildiz, Understanding Schizophrenia, is a good book. Talk about these main symptoms. Another suggested reading is the website of Association of Psychiatrists in Turkey. But there is a lot of disinformation. There are so many books. They are saying that these bodiless spirits come to other bodies and the schizophrenia is happening that way. So there are some materials saying that, and they're claiming that people with schizophrenia are coming extraterrestrial under the extraterrestrial beings, and they are really claiming that to be true, and people are believing in them. Therefore, we have to stick to some basic books published by official organizations and associations, because almost everyone lectures about that. You go to a psychosis forum, they say, don't use medication. I use that and I'm ruined. And we tell them, don't say that. You have to be sane. Some people are saying that. Therefore, disinformation in the internet is very high. Therefore, you have to be very selective. Thank you very much, Professor. One last question then. One last question. Do you think that psychotic thought disorders are more common in the new generation, especially computer games and TV shows? Can you say there's an increasing trend? I don't think so. But the risk factors are increasing. People are forced to migration. There is more prevalence of violence. People are using more substances. Cities are getting more crowded. These are all increasing risk factors. If the world turns into a heaven, maybe there will be less psychosis, but all the risk factors are increasing. The income distribution is not balanced, not fair. So there are a lot of negative risk factors. While these are there, we cannot simply blame computer games, simply. So now people are having a lot of concerns about truth testing, the post-truth era. Believe half of the things that you hear, or believe how, even it is hard to believe what we see, because with artificial intelligence, everything can be generated. Sounds can be generated. Images can be generated. So truth testing can be, reality testing can be a challenge in nowadays world. Therefore, you have to work more to understand what is real or not. But I think just all these factors may not increase the number of people with psychosis, but it is more confusing for all of us. That doesn't mean that we are all ill just because we are confused. During my master's, I read a book by our professor on schizophrenia. Probably it has translation as well. Probably our participants like to look at that. What was that book again? Do you know the name? On Schizophrenia. That's the name. I'll give you the writer as well. I haven't promised you a garden of roses. It is also a good example. It's a literary example. It's a book on what can be treated. I think it's based on a real life example. If you are more into fiction, it might help you. Thank you very much for your time, Professor. The name of the book is On Schizophrenia, and the author is Esme Enjun. Maybe it is not a very well-known book, but I really enjoy it. It helped me while reading. Thank you very much for your time, Professor. It's been a very informative night. Thank you very much. It was a pleasure for me as well. Good evening, everyone. Thank you very much for being here. Goodbye.